Hi, good evening. We're going to talk about fluoride. So what is fluoride? Fluoride is a natural mineral. It's found in our food and drink. So it is absorbed through the body, through our bloodstream. We'll drink the water and we absorb it. So dentally, on a pre-eruptive tooth, so it's the tooth, you have a tooth bud and it's surrounded by a fluid-filled sac. And there's fluoride in that fluid, and it strengthens the enamel of that forming tooth. So once the tooth has now erupted, fluoride is still used because it can continue to alter the enamel and make it stronger. So demineralization, this occurs when plaque is present. So a cavity is formed because the mixture of sugar and bacteria cause an acid, and that acid starts breaking up a tooth. So you can see right here, you have these white spots right here, right here, right here. And this is typically what we see after somebody has braces. Braces do not cause cavities, but because it's harder to brush, sometimes the bracket will be here and they're just not getting this. So the braces will come off and then you have this, and it's not a cavity yet, but it's a demineralization. It's the breaking down of the enamel. So this is a place where fluoride can really help. So fluoride in this situation, the fluoride in the saliva restores the minerals to a demineralized tooth structure. And this can only happen in the early stage. Once this becomes a cavity, we cannot do anything about that. So the benefits of fluoride is to reduce dental caries, both in permanent and primary teeth. And it goes through our body systemically for the teeth that are just forming, or topically for the teeth that are now already erupted, now that you can see in the mouth. Systemically, it's ingested in water, our food, beverages, and supplements. It's added to certain public water, and you're going to do a fluoride debate. I don't know if you've been assigned that yet, but you'll divide up into groups, pros and cons. You'll watch a little video. Many towns are debating this now, whether or not this is a good thing to put into our water supplies. It's good because it helps strengthen the teeth. It's bad because too much is not good, as you're going to learn, and it might not be good for everybody. So topically, it's going to penetrate the outer layer of the enamel. This is a very low concentration, and this is something you're going to learn how to do. The factors to consider. One of the main things you want to remember is this is not a one-size-fits-all. So is the patient, what's their caries rate, what's their age, and do they have fluoride in their water? So mouth rinses, it can reduce caries 20 to 50%. They can be used daily or weekly. They're very good for orthodontic patients. They're good for patients that are going through radiation therapy. If a person has cancer or something, they're going through radiation. The radiation will actually dry up their saliva ducts, and their saliva is what's helping remineralize the tooth. And so without it, the teeth are becoming demineralized. It's not recommended for preschoolers. So anything like this you have to keep out of the reach of children, because it's a liquid, it tastes good, yummy, and they're going to drink it, and this can be deadly. So fluoride varnish. So this is used on hypersensitive areas, on newly erupted teeth, or adults, particularly from right up by the gingival. They might have some gum recession, and so you have the enamel that's hard, and then you have dentin, and dentin is soft and very, very sensitive. So if they put this fluoride varnish on it, that helps. So it comes in different gels and foams and flavors. So APF, this is 1.23% fluoride. It's professionally used, so you do not buy this over the counter. You use them in the custom tray. The gel flows through the teeth and it strengthens it, and this can be done every 6 to 12 months, and this is typically preferred. So NaF, or neutralized 2% sodium fluoride, this is of cases of erosion are exposed dentin, like we talked about, carious dentin, porous enamels. This does not irritate the gum tissue, and it does not discolor. As opposed to compared to the stannous fluoride, they're a little bit more high concentrated. They're used on high risk patients, but they do often stain and they do often cause gingival irritation. So in an office application, you do it every 6 months recall. You place the gel or sometimes foam in a tray, and it goes in the mouth. It says 1 to 4 minutes, but typically it's 1 minute. You're going to use a saliva ejector. You're going to ask the patient not to swallow. You're going to wait 30 minutes before, you're going to instruct the patient 30 minutes before they eat or drink or rinse as they go off. So the tray set up, and you're going to have a lab on this. You're going to have your basic setup. You're going to have your saliva ejector, your HVE, your air water syringe, cotton rolls, gauze, fluoride, the fluoride solution itself. And typically they come in flavors. You can ask your patient what flavor they would like, and then the tray and a timer. And here's the tray. So sometimes it's a double arch and sometimes it's a single arch. We like to use the double arch because it just gets done. You're in and out. You put a saliva ejector in between there. If you just do the one arch on a child, it's hard to get back there to do the second arch. So this way, 1 minute and they're done. Home treatment again, this is used and recommended for people that might have, like I said, radiation treatment or braces or some special condition where they would be recommending home treatments. Now we have some dangers of fluoride. So too much fluoride can cause fluorosis, and this is a muddled enamel. According to the CDC, excessive fluoride can not only lead to fluorosis, but it can result in increased prevalence of bone fractures in the elderly. Excessive fluoride can lead to, again, fluorosis. And here's a slight case, so you see these white spots on it. And that's just like the beginning, and it's permanent and it does not go away. So the ADA just lowered its standard. They used to say that for adding to the water, it was 0.7 to 1.2, but now it's recommended not to go above 0.7 parts per million in water. You're going to keep away from children. And so the main thing is just know how much your patient is consuming before recommending it, either systemically or topically. Thank you very much.